Hi, my name is Tim Long. I'm the CEO and founder of New Life Medical Centers, and today I'm going to talk to you about my personal experience with having, my road after having a knee injury to getting it healed or healing it, and kind of the process. So this is not medical advice. This is purely anecdotal. This is my personal experience only. It doesn't mean you're going to have the same result. Everyone is biochemically different and can have a different result. So it all started back when I was playing basketball. Tore my knee playing basketball. I was playing, multiple sports. I was softball, volleyball, basketball, golf. Just doing, I was pretty active. I was 28 years old at the time. And when everything was said and done, I severed my ACL and tore my medial meniscus, which is the meniscus or the cartilage on the inside of your knee. In this case, it was my left knee. And when it had to go in and have surgery, and what they had to do, because I severed my ACL, is they took the center third of my patella tendon and they attached it to two pins and obviously ran it through the joint, and they removed 50% of my medial meniscus. And the portion they removed was the portion that was on the outside. So when you have those little humps on your bone, that's where they removed it. So even though I still had 50% of it, it was on the inner part of the knee where there's not a lot of blood flow either. And it's not where that hump is. So after my surgery, there was, I had a lot of bone pain, and I couldn't go back and play anything that was high impact. I actually went and tried to play softball. I played one game, and after the first time I rounded that first base, I said, I'm done. It was just because it's just, if you've got a bone, I'm talking about, it's just boom, 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 every time you take a step. So anything above walking, I could feel that bone on bone. Even though I went to rehab right after the surgery, I had full movement in, less than 2 weeks, which is considered 132 degrees. I didn't have normal movement. And what I mean by that is even though I was stretching it every morning for an hour and every evening for an hour, and sometimes even during lunch, I would, that's why I got full movement so quickly. And as you know, it's painful, it's not fun. And you got to push through the pain to reach that. And I could never squat all the way down. Though it was full movement, it really wasn't, because, for example, I could touch on my good leg or my right leg, I could touch my heel to my glute. On my left leg, I could never, and I stretched and I stretched and I stretched, I could never get it more than 7 or 8 inches from my glute. So when I would play catch with my son, even when I was coaching, when I would go down and sit on catch, I'd have to lean over because I could never bend this knee fully. And it just got to the point where it was so uncomfortable, I ended up having to sit on a bucket to catch because I could never squat down. And that concerned me a lot, because I was still pretty young at that time. I was figuring, man, when I get older, how is this going to affect me? Because I can't squat all the way down. So like even squat down and get on the floor, it was weird because I could never bend that knee. So some of the other issues I had after the surgery, obviously I couldn't go back and play any of the sports. I couldn't squat all the way down, even though I considered it had full movement. I had, every time the weather changed, I had pain in my leg. I knew when the weather was about to change, get cold, get hot, and the storm was coming in. I could tell. You could too, probably. This isn't funny, but it was funny in a way, because my knee would pop out of place all the time. If I was driving down the road and I would lean my leg against the door, pop out of place. And I had to reach over there and kind of pick it up, and it would pop back in place. People could actually hear it and see it. Actually, my stepdaughter saw it. Cross my legs behind my back, pop out of place. Sitting on the couch and cross my legs, pop out of place. So I always had to kind of be aware of how my leg was positioned. Now it did hurt, it didn't hurt crazy hurt, but it was uncomfortable, and I knew that was not good for it. So when I would drive, I had to make sure my leg was straight up and down. I couldn't lean it over. So I couldn't squat, the leg would pop out of place. I couldn't play any of the sports, and it just kind of, anytime I was set for a long period of time, either at a desk or in a car, it was always stiff as a board when I got up. I always had to stretch, it sucked. So I was taking glucosamine chondroitin and that kind of stuff. I didn't take a lot of pain medication or ibuprofen and that kind of stuff, because I didn't want to, deal with the kidney issues and stuff like that down the road. I just wanted to try to take care of it as best I could. and that's why I quit playing any type of high impact sport, because I wanted to preserve whatever cushion I had in there, and I didn't want to make it any worse. So before, I started a clinic. I started a clinic over 10 years ago now, and when I started a clinic, it was to actually heal patients. And I'll talk about this in another story, but I come from a genetic makeup that's horrible. My family on both sides is heart disease. Quadruple bypasses, in their late teens, early 20s, type 1 and type 2 diabetes, cancer, all of it is a mess. And I got to the point where I started having high blood pressure, and I was developing type 2 diabetes, and I could just see what was coming down the road. And this was in my late 30s, and I decided I'm gonna do something about it. Went to my doctors. All they wanted to do was put me on medications. They didn't want to actually try to treat the problem or teach me how to maybe reverse it or maybe heal it, cure it. They just wanted to treat me. And I did my own research because I refused. I didn't want to go on any of those medications because I knew once you go on them, you're on them for life for the most part. And I started doing a lot of research, and when everything was said and done, I ended up starting my own clinic. And the clinic is designed to help people heal. It's not just to treat the symptoms, although you have to do that sometimes, but you can reverse a lot of situations. So now, I'm not on high blood pressure medicine. My blood pressure is normal. I'm not type 2 diabetic, and I was able to reverse and stop all that progression. So that kind of leads us to this point. So how do we, I started trying the cortisone shots, and we know that those are not good long-term, and I've only done 1 or 2 of those. Obviously, those are very temporary, just get rid of the pain, like we discussed in another video. I tried the gels and all the other stuff, and it's just all that's temporary always comes back. And of course, those are very expensive too, especially when it's for something temporary. It's very expensive, in my opinion, even though insurance will cover some of it. And then we started doing research, and because we do regenerative type medicine and functional medicine, and came across. Well, we first heard about it, all the celebrities and stuff going overseas to Germany and getting, platelet-rich plasma, PRP. Then it was stem cells. So we started doing research for it, and come to find out that you can get some of those products here in the U.S. They're different outside the U.S., but in the U.S., they were starting to develop those products, and we started testing those products. Like I said in the video, we first started testing platelet-rich plasma in our own stem cells, and that's where you pull the stem cells from your own body. And what we found out is that the stem cells that you pull from your own body are the same age as you are, so they're just not as effective as they were when you were in your teens, or when you were growing. So obviously, the older the cells, they're just not as effective, and there's not as many. So although those treatments, the PRP and stem cell treatments, would help with the pain and get rid of some of the inflammation, it was just temporary. Now those will work for something like tendonitis, like an elbow. But if you're trying to regrow or heal a major tear or regrow tissue, that's not going to work. But we did try those. And then the next thing we came across, which was amniotic allograft products, or what was called Wharton's Jelly back then. And we decided to test that. So we went to the training, met with the labs and the doctors. They trained our physicians, providers, and I was the first guinea pig. Because before we launch anything and offer anything to our patients, we want to make sure it works. Now, every patient is biochemically different. Everybody can have a different result, but we want to make sure before we offer anything to a patient, they're going to have the best chance possible that they're going to get the best result they possibly can. There's not a better product out there, at least as far as what we've known and what we have researched. And believe me, we stay on top of everything. So we want to offer the best to the patient so they actually get a result. Everybody's sick and tired of being overpromised and underdelivered, and we try to do the opposite. We try to underpromise and overdeliver. So we started testing the products before we released them to the patients. Obviously, I'm a good patient because I've got lots of injuries, or a good test subject. So we did the first injection. It's very simple. It's not much more than a cortisone shot. Not very much pain at all. Again, everybody's different. And as soon as the injection was over, I was up and back to work. There's no downtime. There's no rehab. None of that. All they told me to do, and I always suggest to do, is don't do anything high impact or lift anything extremely heavy. Like if you would lift weights, just skip legs for a month, or at least don't do anything high that's heavy, because you want to give that product time to start healing the body and start building new scaffolding and new tissues in there to stabilize that joint. So after 30 days, I went back in because in my case, I had 50% of my medial meniscus was removed. I was hoping to regrow it. And we went in the 5 weeks after my first injection, got my second injection. And during that first month, I noticed within a couple weeks that the pain was gone because when the weather changes, it's changing. It's about to get cold, it's about to get hot. The storm's coming in because you can feel it. That your knee starts to hurt a little bit. Well, that was gone. The stiffness from when I was riding the car, sit all day, that was kind of gone too. I noticed it after a few weeks. Again, everybody's different. My leg, my knee stopped popping out of place. I mean, it was popping out of place a couple of times a day. And I noticed that it stopped popping out of place. It just wasn't popping out of place anymore. But again, I was still being very careful with it for that month. So I went in and got my second injection and went to the gym 3 days later. And I was over stretching because I was going to do legs because it's now time I could go back and actually start doing leg workouts. And I was over stretching. And for the previous 19 years, like I said earlier, I could not squat all the way down. I could never touch my glute to my heel to my glute. There was always a distance because I'll reach back here and kind of feel between so I could tell. And it was always about that much. I could go back and forth probably about 7 or 8 inches. And that day, all of a sudden, when I was stretching it, it was actually less pain than it was in the past. Because when I was trying to stretch before, it felt like it was almost like my knee was exploding. But this day, it just felt like a rubber band. It was weird. It was a weird in a good way. It felt like a rubber band was stretching, almost like I could feel a little, I don't know if it was scar tissue breaking up or whatever it was. I don't know what was happening, but it felt like a rubber band stretching. And I stretched all the way. My heel touched my glute for the first time in 19 years. And that was crazy. I mean, that was a good day. It was exciting. I was so happy. And one of my friends was in the gym, and he saw the look on my face. I wasn't talking about it. I was just like, I guess you could see the look on my face. He came over. He said, man, what's going on? I could see the look on your face. I said, well, for the first time in 19 years, I just touched my heel to my glute. I got, stem cells, Warden's jelly, injections or stem cell injections to keep it short. Yesterday, or 3 days ago, today, I'm touching for the first time in 19 years. Now, he was happy for me, but he didn't really understand what I was actually feeling. Because I knew now this stuff really works, and I'm not gonna have to, whatever's coming down the road, I've got something we can use for it, and I can have full movement in my knee again, and I'm not gonna have to suffer the rest of my life. And it just got better after that. It got to the point where I could actually start, I was playing volleyball again. I didn't play basketball because I felt like I got too slow. But I was playing volleyball, golf, I started boxing again, and it was great. I wasn't stiff when I sat in the car rider all day. I didn't have that pain every time. I quit taking glucosamine chondroitin because I just didn't need it anymore. And I had an awesome result. And that doesn't mean you're going to, but I had an awesome result. And our patients, we've had great success with it after we launched it. And what was great about it, and this may sound like it's not great, but about a year later, I was on vacation and slipped in a hot tub, one of the hot tubs at the resort. And I guess the step was curved. And when I stepped in it, I went down in it, but my leg that I had the surgery on stayed on top. So my knee was out of place. I mean, you could see it was out of place. I had a couple buddies there, they helped me get up. And when I stood up, it popped back in place like it used to. And I was like, man, I just had this fixed. And took 2 or 3 steps, and all of a sudden, every time I took a step, I could feel like a little flick in there. And I was thinking, man, I just had this done, and now I ruined it. Then all of a sudden, it's like, oh, there's cartilage there. There's a flicking where I didn't have cartilage before. So if you've torn your cartilage before, sometimes you have like a little flick. You can feel it when you're moving. It'll like a little rubber or whatever, a flick inside. And that's what was happening. Every time I took a step, I could flick. Now after about a day or so, that kind of stopped. But I was happy because I knew the amniotic alveolar products worked, and there was tissue where there was no tissue before. And so I was happy, excited. Although I tore it again, I was happy because there was tissue there that wasn't there before. So I went back in. When I got back after vacation, we scheduled, I got another injection and haven't had a problem since. So that is my personal story and my journey with a knee that had ACL reconstruction, 50% of my medial meniscus removed, and my journey back and over a period of years. And that doesn't mean I'm not going to have injections in the future, because I still lift weights. I'm still trying to stay active and stay in shape. I may injure it at some point, and you may have to do that more often. But when compared to those other injections and the PRP and your own stem cells and the visco supplementation, those are all temporary. This is the only product that's going to give you a chance of being something more permanent. And that's why we use them. That's why we offer. Now, we offer all those in the clinic. So it's up to you what your choice is. You get to pick what you want to do. But as far as actually trying to heal the issue, we believe, especially if it's something major, this is probably the best product that you can get in the United States at this time. Now, if there's something that comes out in the future, we're always going to test it, and we'll let you know. But at this point, the products that we offer to our patients are the best in the country. They are expensive, but we feel like they work. And they're in line, or even sometimes a little bit less than the so-called stem cells that they pull from either bone marrow or adipose. In some cases, a lot less, but they're still expensive. But if you have issues with pain or healing tears, some pretty severe tears, or even cartilage, you want to stabilize that joint and give yourself a chance to heal it, that's probably the best product out there by far, at least in our opinion. So that's my personal story, my struggles I've been through, what we've tried here in the clinic, what I have tried personally, and that's what we believe in. So if you have a lot of pain in your knee and you're discouraged, don't be discouraged like I was. There is a solution. So just give us a call. We'll be glad to answer any questions we can. We will not overpromise. We're not going to sell anything. If anything, we're going to try to under-promise and try to over-deliver. And that's why I've said so many times in this video, it doesn't mean, just because I had this result doesn't mean you're going to. But sometimes you just don't know till you try. So if you have any questions, feel free to give us a call. We're always here for you.